Hello everyone. Welcome to today's session where we explore the details of a powerful medication known as fentanyl, including its generic form and various brand names such as Actiq, Duragesic, and Sublimaze. This discussion is for educational purposes, and it's crucial to consult healthcare professionals for personalized medical advice or concerns. Description: Fentanyl is a synthetic opioid that is significantly more potent than morphine. It is primarily used for managing severe pain, typically in patients who are already tolerant to other opioids. Fentanyl is available in various forms, including injections, transdermal patches, and lozenges. Its rapid onset and potent effects make it an essential drug in both surgical settings for anesthesia and in chronic pain management for conditions that do not respond adequately to other opioids. Due to its strength and potential for addiction and abuse, fentanyl is classified as a Schedule II controlled substance in the United States. Warnings: Fentanyl should be prescribed only by healthcare providers who are knowledgeable in the use of potent opioids for the management of chronic pain. Patients with respiratory conditions or those prone to respiratory depression should use fentanyl with caution. It is also contraindicated in patients with known allergies to any components of the fentanyl formulation. Due to its high potency, even small doses can be lethal to individuals not regularly taking opioids, including children and pets. Thus, it must be stored securely and out of reach. Before taking this medicine. Before starting fentanyl, it is essential to review one's medical history with a healthcare provider, especially regarding any history of respiratory issues, brain tumors, head injuries, liver or kidney disease, and mental health disorders such as depression or PTSD. It's also crucial to discuss current medications to avoid potential serious interactions, particularly with drugs that depress the central nervous system. Pregnant or breastfeeding women must consult their doctor due to potential harm to the fetus or the nursing infant. Patients planning to become pregnant should also discuss the possible risks. Side effects: Common side effects of fentanyl include nausea, vomiting, constipation, drowsiness, confusion, and weakness. More severe side effects may include respiratory depression, severe hypotension, and addiction. Overdose can lead to life-threatening issues such as stopped breathing, coma, and death. Observing these side effects or any signs of an allergic reaction, like hives, difficulty breathing, or swelling of the face, lips, tongue, or throat, requires immediate medical attention. Interactions: Fentanyl can interact with various medications, which can lead to dangerous effects like severe sedation, respiratory depression, coma, or death. These interactions are often with other opioids, sedatives, tranquilizers, sleeping pills, muscle relaxers, and medicines for anxiety or seizures. Always inform your healthcare provider about all other medications and supplements you are taking. Dosage: The dosage of fentanyl must be precisely followed as prescribed by your doctor. The dosage can vary widely depending on the form being used: patch, injection, lozenge, the severity of pain, the treatment setting, and previous opioid use. Due to its potent nature, modifications should never be made without consulting a healthcare provider. Patients should avoid alcohol while taking fentanyl, as it can increase the risk of severe side effects including death. Caution should be taken when engaging in activities that require full alertness or coordination, such as driving. FAQ: A common question is about the safety of fentanyl in children. Fentanyl can be used in children in a controlled medical setting but is generally not prescribed for home use in pediatric patients due to the risk of overdose and severe respiratory depression. Closing: That concludes our discussion on fentanyl. This overview is meant to provide educational content and is not a substitute for professional medical advice. If you have any questions or concerns about using fentanyl or managing pain effectively, please consult with a healthcare provider. Thank you for joining us today.